Hi guys, my name's Chelsea. I'm the sexual health nurse at Danila Dilba, planted in Nucky Street in the city. I just wanted to get on as it's coming towards the end of Syphilis September and say what a great job everyone's done at their point of care testing and being really thorough with their assessments and identifying when people need treatment and further testing, and you've all done such an amazing job. And I wanted to read us a little storybook called Go Along Philis, as we are talking about syphilis. Syphilis is on the rise in the territory. We are doing a great job at trying to get on top of it though, but it seems like we're sharing it faster than we're curing it. But that's where we all come together and we ensure that we normalise this conversation and have a chat with our friends about safe sex practices and making sure that we all get tested. There's no shame in it. It's actually really important that we all just get tested, or wear a condom even, or both. Both is great. So we're gonna have a read along. Just a disclaimer though, this does have some images in it that might be quite disturbing for some people. It does have some sores on genitalia and it has some pictures of some babies born affected with syphilis. So, just so you're aware, those images are in here. Go along, Phyllis. Hey you mob, have you met Phil and Phyllis? You might have without even knowing it. We are Phil and Phyllis, a sexually transmitted infection called syphilis. We've been getting around in Western Australia, spreading fast throughout the regions and the city. You might meet us by having vaginal, anal or oral sex without protection, rubbing up closely with someone, sharing sex toys. We like to hide. Most people that meet us have no idea that we have stuck around with them. Most people look good and feel alright. Don't ignore us though. Sometimes we can give you sores on your mouth, penis, vagina or bum. This is called primary syphilis. You might get a sore or lots of sores. The sores won't usually hurt or last long, which makes them easy to miss. After the sores are gone, you might think that we have left, but we haven't. Instead, we are turning into secondary syphilis. You can feel sick with a fever, body aches, rash, patchy hair loss, warty growths around your bum and groin, can have vision, hearing loss. Could you be pregnant? It's important to take a pregnancy test. Syphilis in pregnancy can cause serious harm to the baby. The baby could die. So, you're pregnant. If you are pregnant, you will need to be tested for syphilis a few times throughout your pregnancy because we can spread to your baby. Your baby could die or could have serious health problems for the rest of its life, like bone deformities, brain disease, heart disease, blindness, and loss of hearing. So syphilis is able to travel from the mum into the placenta and through the bloodstream and into the baby. It's just a little prick. Could you have met Phil and Phyllis? If you think you have, it's important to get a simple blood test. If you have a sore, a swab will be taken to check if it's syphilis. You can get this test at your local clinic, Aboriginal Medical Service or hospital. While you're there, you should also get tested for other STIs and blood-borne viruses like chlamydia, gonorrhea, hepatitis B, hepatitis C, and HIV. We're here! So, if it turns out you have met us, you will need antibiotic injections to get us to go along. Go on, get. The earlier we are found, the quicker we will go along. Remember, medicine won't stop you from meeting us again. It's important that your sex partners know they have probably met us too. This is called contact tracing. Contact tracing. If you have been told that you have met Phil and Phyllis, it's important you get tested and treated immediately. This stops Phil and Phyllis getting around your community. It's important that sex partners know so they can get tested and treated too. So this is how quickly syphilis gets around. So just two people, and then maybe one of them has sex with someone else, or both of them do, but they're both infected, and they both do, and then they've infected, two others, and then they've infected, 3 others, 4 others. Oh, that easy. It is that easy. Don't be ashamed. If it's too shame telling your sex partners that they might have syphilis, your healthcare worker can help. We do have a website that we can actually go on, so no one has to be named, and that it's completely anonymous. They have no idea. So a health worker can definitely help you be anonymous in your telling. What you tell your healthcare worker about your sex contacts is private business. Your name will not be used and you will not be shamed. Get Phil and Phyllis to go along. Still not tested? You might think we have gone, but we haven't. We're hanging around for a long time, waiting to become tertiary syphilis. Tertiary syphilis can cause lifelong damage to your skin, bones, brain and organs. This cannot be undone. What now? Get tested and treated to keep your community safe. If you're pregnant, make sure you are tested early and regularly. If you have tested positive, remember your follow-up checks to make sure your treatment has worked. And there we have Phil and Phyllis dead. So all it takes is penicillin. Shots of penicillin and syphilis is gone. Not gone forever, which is why we have to be careful every time we're having sex with a new partner. We're using a condom, we're getting our sexual health checks and making sure that we don't have any STIs or bloodborne viruses like hepatitis, HIV and syphilis. So easy to do, get tested, no shame in it, no one's judging. We appreciate so much when people come and get tested, and just be honest, no one's going to tell anyone. Bye for now.